I think it's too unsafe to do you here in the office.
I'm here with Roger, who has the most extensive case of Rynophyma that has ever been seen. Dr. Richard Bennett has agreed to join me here, and he has extensive experience in facial skin surgery. But we've decided we can't do Roger today. I mean, this is too extensive of a case. There's too many potentials for complications, and I think the risk is too high.
Oh, God.
I know, Roger, I feel like you always feel like you're hitting a wall here. You've got so close and then yet so far. It's best that Roger goes under general anesthesia with extra blood around that we can transfuse him with if he has a lot of blood loss. General anesthesia is when you decrease someone's consciousness so they're not awake and they don't perceive pain. This is an even more controlled environment. This is something that I know is so heartbreaking for him, but I have not given up on him. We are going to figure out a way. Hello, Valerie.
Hi.
Hey.
As you can see,
Right.
your brother, he doesn't look much different now.
Okay.
So we couldn't take it off today.
Okay.
But the good news is we definitely have connections, and so we're gonna figure that out. So this is not the end of this at all, by any means.
I really wanted it done because I was willing to, waiting for this weight to come off me, but it didn't come off, so. This is my second time coming over here and hearing it, so I don't want to hear it again.
All right, bro. Ready to go?
All right. I really am disappointed. I've been out here to California 3 times, and last time I was here, they started the procedure, and then all of a sudden they told me that I was bleeding too much, and they had to stop. I felt devastated and heartbroken because this is already too many times for me. I've already given up. Back home, I felt all depressed, and the rest of my life, do not want to live like this because I won't want to live.
I met with Roger 7 months ago, and his Rynophyma is very complex. It's obviously the biggest Rynophyma I've ever seen because there are potential complications to doing a surgery that might have a lot of bleeding. We really need to do this in a more controlled, monitored environment. So today we are at Osborne Head and Neck Foundation.
I'm Roger Hernandez, and I have an appointment today.
I'm gonna go ahead and check you in. I'm gonna have you have a seat, and then we'll grab you in just a little bit, okay?
Okay.
The Osborne Head and Neck Foundation is founded by Dr. Ryan Osborne. After Roger's procedure, I called Dr. Osborne. His team at the Osborne Head and Neck Foundation specialize in really complex head and neck surgeries.
Hi, Roger. We're ready for you. Want to come on back?
Is this gonna be it for him to stay back?
Yeah, he's
All
gonna
right,
stay
bro.
back there. All good.
I'll see you afterwards, bro. God bless. Love you.
Let's see. Hello, good morning.
Good morning.
Dr. Lee.
Hello, hi.
How are you?
Nice
Dr.
to
Osborne.
see you.
We've got a game plan for him today.
Fantastic,
Why
and
don't
I'm
you-
so excited.
You got yourself coming
about
back
all
with
of
me.
this.
Dr. Hamilton is back here.
Okay.
We'll talk a little bit.
Okay.
I got a call from Dr. Sandra Lee. She called and she reached out about a patient, but Roger's case was extraordinary. He doesn't really fit in a plastic surgeon's office. He's not really a cancer case, so he doesn't fit in a head and neck oncologist's office. So he would fall through the cracks in a normal situation.
I am so excited about this and what it's going to do for him. I know it's a long time coming.
Yeah, absolutely. We're happy that our foundation is able to kind of contribute.
What is this foundation?
It's the organization that has allowed us to travel around the world and do these missions internationally completely free of charge for patients. So the foundation is actually covering anesthesia, OR costs, I mean, literally everything that has to do with the surgery.
You just gave me goosebumps. I mean, there's so many moving parts that were necessary to allow this to happen. This is a big deal. So what's the plan for today?
The first issue is getting Roger under anesthesia safely. There's no way to mask him or ventilate him easily.
Oh my goodness, yes.
Once we get through that phase, the next component is really to just remove the burden of the Rynophyma off of his face. 2 excellent surgeons have already tried this, and they saw bleeding. What are we gonna do that's gonna be different? There's probably gonna be some blood loss. And if we get over that, it falls into nasal recontouring and actually trying to give him a nose.
This is a 3-pronged procedure. First is the intubation and anesthesia, and this is risky because of a potential airway obstruction. Number 2 is the removal, which is risky because of the loss of blood. And number 3 is reconstruction.
So, are you ready? Should we go take a look at Roger?
I'm excited.
All right, let's go see him.
We know a man's life is in our hands. This is an extremely risky procedure. There is a high potential of excess bleeding, but I know that we have the best doctors for the job.
Roger.
Hello, how are you?
All right.
We meet again.
Yeah,
Nice to see you.
you too.
I'm just gonna take this mask off so we can kind of go over a few things. So, just the sheer size of the tumor, it's completely blocking his nasal passage. And the second one is blocking access to the oral cavity. And normally when we put someone under general anesthesia, we have to be able to give them oxygen. We know somehow we've got to get him under general anesthesia without having normal access to either his nose or his oral airway. We'll have to put a small incision in the neck, open the actual windpipe, the trachea, and then put the tube in there, and then hook him up to the anesthesia machine. Do you have any questions for us?
When are we gonna start?
When are we gonna start?
You're excited,
Great
aren't
question.
I want to get this heavy weight off me.
Yeah, you've been waiting a long time to get this done. So.
All right, so Roger, we're gonna start by shaving your beard and mustache, and just so we can see what's going on with the rest of the skin. Is that okay?
Yeah.
Roger is having his beard shaved for a few reasons. It really is obscuring our ability to see the area very well. And certainly it can be a nidus for infection. It takes away some complication from this already very complicated surgery.
When you wake up, how are you gonna look? Handsome, that's the right word. Awesome.
Why don't you get at the head, Laurie?
All right, young man, you ready?
I'm just wishing that it would happen already. I'm hoping that they don't have to stop like last time I was there. Been a long journey. The last time I saw Dr. Lee 2 months ago, my whole life has changed. Took a long time for my nose to heal, but now my nose looks great. And now that I have it fixed, I could do the normal things like eating, drinking, and sleeping. I could just sleep right and not getting no pains or nothing. And I could breathe, thank God. And I'm happy. I want to just go out there in the street and show myself.
It's about time you got here. About time.
Now, I could go to parties and my family reunions. I missed out on, 10 to 12 years of that. And that's what I really missed. I wouldn't go because of my nose.
Where's my brother?
I go out in public, a lot of girls look at me, though. Now all these old ladies are talking to me. I mean, I don't mind. I mean, when I met Dr. Lee, I wasn't happy. But now I'm happy because Dr. Lee, Dr. Osborne, and Hamilton changed my life. Now that my nose is normal, I feel great. Now I could go and see the world.